Hey guys, what's up? It's Aaron here with Iron Therapy Training, and today we're going to talk about your lumbar spine. We're going to talk a little bit about bulging discs and degenerating discs, and then we're also going to talk about your lumbopelvic hip. And if you're ever experiencing, that unwanted pain right here on the front of your hip, or if you're feeling that popping sensation right here on the inside of your hip or on the front of your hip, when you're doing movements like the squat movement or leg lifts. And then I'm going to talk about a couple muscles that are really important to strengthen to help fix this and make this problem go away. Now today, one of these muscles that I'm going to talk about is the psoas muscle, okay? The psoas muscle here, you can see as it ties into your T12 and goes all the way down here to your L4 in your lumbar spine here. And it attaches to the very beginning of your thoracic spine right here on T12. And then it comes down and it ties into the inside of your femur, which is the lesser trochanter right here, where this bony projection is, okay? The lesser trochanter right here. Now, the reason why this muscle is so important is because if you look here, each one of these blue spots here are discs in your back. And I always like to refer to your discs in your low back kind of like the analogy of an airbag on a truck, okay? And what happens to the airbag on a truck if you overload the truck's airbags? What happens to it? It compresses that airbag for one, and it bulges it, right? It bulges it out before it blows. Well, your back's kind of like the same way here, your vertebrae here. Those discs are like shock absorbers for your vertebrae. They're not meant to hold all the weight. So when this muscle here gets weak on your low back, what's left supporting all that weight are the discs. And having too much pressure, too much weight on those discs for a long period of time causes them to bulge out and start to compress, which causes, degenerating discs. Now, this can also come from lifting improperly for a long period of time and not having the right support on your spine here, okay? And supporting this vertebrae here. Now, this muscle here, which is the psoas, ties in down here to the lesser trochanter here where this bony projection is. You also have your ilium right here, where your iliacus muscle also ties in to the lesser trochanter, which is this bony projection right here on the inside of your femur. Now that popping sensation that you're feeling when you're doing your squats or your movements, you're feeling that pop and that pain. Well, that popping sensation could be the tendon rolling over that bony projection right here on the inside of your femur, the lesser trochanter, and it's actually rolling over, causing that popping sensation. So this muscle here, by strengthening this muscle, the iliopsoas is another way we can look at it, calling it is the iliopsoas, because they're kind of connected together. By strengthening this muscle, it can help support these discs in your low back. It can help with low back pain. And most importantly, it helps with your hips. And if you've ever watched anything that I've preached about or talked about with low back pain, the moment you can fix your hips, back pain goes away. So stay with me. I'm going to show you a couple exercises you can do to help fix this. So the first exercise we're going to do today is marching. And marching is one of the best exercises you can do for your psoas and your iliacus, okay? So what I'm going to have Ashley do is she's going to lay down in this position here. She's going to have both of her feet in front of her. I'm going to have her push her low back into the ground, and I'm going to have her suck her belly button in towards her spine. Now, Ashley, what I'm going to have you do is lift this knee up towards your chest and then back down nice and slow, okay? And now other side, we'll do the other side. All right, and back down nice and slow. So this is working out her hip flexor and her psoas, iliacus, iliopsoas, whatever you want to call it, All of those muscles are working together right now as she's doing this movement. This is going to help her, support her low back, and it's going to help her with that hip trouble that she's having on the front of her hip and that popping sensation that she's been having. So this is just one of the exercises that'll help. Stay tuned and I'll show you another example. All right, so the next exercise that we're gonna do today to help her with her hip pain that she's been having is we're gonna have her do some clamshells here. Now, she's gonna lay on her side just like you see here. Her knees are gonna be slightly bent. Both of her feet are gonna be stacked on top of each other. And what she's gonna do is externally rotate this hip up as far as she can go, and then she's gonna come back down nice and slow. Now, as she does this, it's really good to have her hold, pause there for a couple seconds, 1, 2, and then come down slow. Now, this is gonna work out her glute med here on the outside of her glute, and it's also gonna help with external rotation of the hip. Now, once you strengthen your psoas and your iliacus, those two muscles also help with hip external rotation and the stabilization of your pelvis and your hips. If you guys have any more questions on anything like this that we could help you with, don't hesitate to reach out. Again, this is Aaron here with Iron Therapy Training. We'll see you guys soon.